So if we have a look and we see that these are the types of groups here that are more likely to be more greatly satisfied with treatment, what are the determinants of patient satisfaction within musculoskeletal care? So the consistent determinants, according to this review, and the most important ones are the therapist's attributes. The therapist attributes. Now these include skill, knowledge, professionalism, a friendly attire, and effective communication. So let's work through these one by one. Skill is important. The skill of a therapist has a significant amount to do with whether patients are satisfied with treatment or not. So this goes to therapeutic treatments, this goes to the implementation and the actual hands-on or exercise prescription side of treatment. So that's skill. Knowledge. Knowledge is very important. Being able to not only have the concepts in your brain, but to be able to articulate them very well through to your clients. Professionalism. So professionalism is one of those concepts that is very much all-encompassing when it comes to a person's first opinion. So when you meet someone for the first time, what do they look like? How do they present themselves? How does the clinic present itself? Is it nice and tidy? Does it smell nice? Is there good lighting? What sort of feel does the clinic have? A friendly attitude. Nobody likes talking to a greasy car salesman, right? People like to have genuine conversations and they like genuineness when it comes to working with a therapist. And then the last one is effective communication. Vin James says this really well in that it doesn't matter if you have the skills of 10 out of 10, if your communication is a 3 out of 10, your clients are going to perceive you as a 3 out of 10 practitioner, not a 10 out of 10. Being able to communicate is the most important aspect of being a therapist. What all of that encompasses though, the skill, the knowledge, the communication, the professionalism, and the friendly attitude, comes down to confidence. If you wrap those things all up in a ball, that's confidence. That is having the confidence to draw on prior experience with clients, draw on a resource library of professional and continuing education that you've done, to understand that first impressions count, particularly in healthcare, first professions count, and then having the confidence to tell patients what they need, because that's why they've come to you in the first place. There's this argument that says we must completely abide by the expectations of what our clients have. We must get their feedback. We must get their input about treatment. And while that's true in most circumstances, a lot of people come and see an exercise physiologist, that's my profession, is that they've tried everything. They've been given management plans, they've been given treatment plans, they've been given advice by their GP, by their specialist, by their physio, by their chiro, by the whole team. And none of it's worked. And that's why they're here. So what they need is someone to tell them directly what they should do, because they're often tired. They're often frustrated. And if you sit there and you ask them what they want, I've had it more times than I can count, is the response to that question is, well, that's why I'm here. That's why I came to see you. The reason that I came to see you is to get your opinion, not for me to tell you mine. So there is a place for both, but it's important to understand that they have come to see you and you need to be confident in delivering your treatment plan to them. So that's one of the most significant determinant when it comes to satisfaction from a therapist and a patient's interaction is confidence, communication, and skill. Along with confidence comes empathy. Along with confidence comes empathy. You cannot build rapport with someone if you're not empathetic to their situation. You're not sympathetic, you are empathetic to their situation. They need to feel like they are being heard. Now, being heard goes to your body language. It goes to the way your posture is, because if you are slouched, if you are leaning back in your chair, you appear disinterested to your clients. We should have a posture where we are perceived to be absorbing the information. Our body language should be one where we are absorbing the information. We are listening with the intent to understand, not to ask more questions. Because I see that as one of the fundamental keys between someone who has just started out and someone who is a confident practitioner, is the genuineness with which people listen plays a significant role in the patient interaction, the therapeutic alliance that's built. So we listen with the intent to understand, not just simply to ask more questions. The second major determinant of satisfaction, patient satisfaction, is the process of care, right? The process of care. So what does that mean? The process of care refers to things like not chopping and changing practitioners, not going from one person to another and having to retell that story again and again. Because when you do have to retell that story again and again, it becomes frustrating. It becomes like, well, I just saw this person the other week. Aren't there clinical notes? Shouldn't you have read those clinical notes before you came in and done the appointment with me? That's frustrating for people. So making sure that we are, if we're taking on someone new, that we plan to see that person ourselves throughout the whole process. We make sure that the frequency of appointments is in line with what their expectations are, or if they don't have expectations, what our clinical judgment determines that it should be. Having huge gaps in treatment can often muddy the image. It can muddy the perception of what progress looks like and what we're actually working towards. Just to add to that point, patients treated by the same practitioner over the course of treatment are approximately 3 times more likely to report complete satisfaction with care than those who receive care from multiple therapists. The mode of treatment can also have an impact on satisfaction. Interestingly, patients with back pain were found to be equally or more satisfied with exercise-based physical therapy treatment than passive treatment. Why? Probably because we explain it really well. Probably because we get them breaking down the barriers or the perceived barriers that they have in there with us and not relying on them to break down their barriers externally by giving them a sheet of exercises that they do independently. There's another great point here, and that is that higher satisfaction is reported when the treatment process is more consultative. However, another study found some participants wanted less involvement in the decision-making process, considering the physical therapist as the expert. So I mentioned this before. There is no one-size-fits-all when it comes to the consultative agreement that a practitioner and a client has. What there needs to be is an individualized element. You need to be able to sit there, read the person who's sitting opposite you, understand what they need, and then give it to them. That's how you build rapport. That's how you build alliance. That's how you create long-term results, is by understanding that there is not a one-size-fits-all approach. Now, this last one is great for clinic owners and for people that are looking at some point in their career to start their own practice. A well-organised physical therapy care is the third determinant of high patient satisfaction. So multiple studies have found that patients were more satisfied if the physical therapy service had easy access, so that's location, parking, clinic hours, helpful administrative staff, low waiting times, and a very high standard of sanitation and care. Obviously, particularly important during the COVID epidemic. But this, for clinic owners, this is so important because this is the third biggest determinant of satisfaction is, can I park easily? Is there public transport nearby? Is it on the ground level or do I have to walk up a set of stairs? Are you open at convenient times? Because now with work days being pretty much 8 a.m. to 5:36 p.m, and if your ideal client sits anywhere between the ages of 20 and 65, getting to an appointment during the middle of the day is going to be pretty difficult. So finding easy ways that people can actually attend your service is really important in terms of them being able to experience what you've got to offer and therefore be satisfied. Now, this last one is really interesting, and that is that the actual treatment outcome was infrequently and inconsistently a determinant of satisfaction within physical therapy. So this finding supports the concept that patient satisfaction with physical therapy care is determined more by interactions with the therapist and the process of care than the actual outcome itself. The interactions with the therapist are more important than the actual outcomes themselves. That is fucking huge. Developing long-term and developing a sustainable business is based off word of mouth. It's based off word of mouth. All the Google ads, all the Facebook ads, all of that stuff is nice, but a sustainable business is based off word of mouth. How you get word of mouth is developing unbelievable client experiences and being ingrained in our clients' progress towards whatever their goals are. And that connection between client and therapist, that connection between allied health practitioner and patient has more to do with their satisfaction than the actual treatment outcome. That's what I'm going to leave you on. Think less about objective measures, think less about specific tests, think more about the person and what that person needs and what they want. Because it's not necessarily a specific functional measure. It's not a specific outcome that they've got in mind. That might be why they made the appointment in the first place, but it's not why they're going to refer their family and their friends to you. It's because they see you as part of the journey. They understand through developing rapport, through confidence, practitioner confidence, that perhaps pain is not the ultimate goal. Perhaps it's the journey that's the most important thing. And anything that you can do to optimize that journey is what leads to client satisfaction. Thank you guys, and talk soon.